Hi, I'm Dr. Lindsay Muscroft and I'm the Deputy Academic Lead here at Warwick Medical School, and welcome to our video on the cardiovascular examination. Just a little disclaimer before we start, all of our videos are based on the sequences that we use here at Warwick Medical School, from our chest handbook and from our course handbook. So please, when you're revising for your exams, please do follow the preferred sequences from your own institutions. And with that, I leave you with the cardiovascular examination.
Hello, my name is Dr. Gill. I've been asked to do a cardiovascular assessment on you today. Before we start, can we please confirm your name and date of birth?
Yes, it's Stephen Nigel. It's the 4th of October 94.
Thank you. So in terms of doing this examination today, it's going to involve you taking off your shirt, as having a look at your hands, checking your observations. I'll also be putting my hands on your chest and listening to you with the stethoscope. Is that okay?
Yes.
So to start off, if I can get you to take your shirt off, please. So just initially looking from the end of the bed, you seem calm and at rest. I can't see any evidence of scars on the chest, nor can I see any evidence of a pacemaker. There's no medications about and no signs of GTN spray. So just having a look over the hands, I can't see any evidence of colonychia, so spoon shaping of the nails. There's no splinter hemorrhages, and I can't see any tar staining. The hands are equally warm and there's no signs of peripheral cyanosis. Just checking the capillary refill. 2. That's completely normal. If you could turn your hands over, please. So I can't see any evidence of Janeway lesions or osseous nodes. And if you got your fingernails and put them together like so for me. Great, so there's no signs of clubbing. So I'm just going to take both your wrists if I can and relax for me. So just feeling your pulse. So we've got a good radial pulse coming through both sides, and if we look into the clock, okay, that's fantastic. So you've got a normal pulse, so about 55 beats a minute. At the same time, I had a look at your breathing, and that's also normal at 12. I'm just going to get the pulse saturation monitor to put that on the finger if I can, and relax down. And at the same time, whilst that's working out, I'm just going to put a thermometer in your ear and just check your temperature. Super, that's fine, thank you. So with the pulse oximeter, we're seeing you've got a pulse of 55 and your sats are 97%, so that's brilliant. Just going to go a little bit higher up the arm. So this is your brachial pulse, and we've got a nice strong character there. So do you have any problems with this arm?
No.
Okay, so I'm just going to grip your wrist a little bit harder and I'm going to move the arm up. Great, so there's no evidence of a collapsing pulse at this point. Now I'm just going to check your blood pressure. So just checking for size, that's okay. And putting that round. So relax down for me. And we're just going to feel the radial pulse for the moment. And we'll increase the pressure until the pulse disappears. Okay, so the pulse has disappeared. And now releasing the pressure. And it's come back at about 120. Okay, so we'll let all the pressure out. We're going to do the same again now with the stethoscope, but I'm going to go a wee bit higher with the pressure. Okay, so listening over the brachial artery. So the sounds have again disappeared about 120. We've gone to 140 now. Letting the pressure out. The pulse sounds have returned at 120 and they've reappeared at 80. Super. So we've got no concerns there. Okay, I'm now going to have a look over your face. So if you would look up for me, please. So there's no evidence of anemia. And look down for me, and no signs of jaundice. Looking around the eyes, I can't see any deposits of cholesterol, and there's no signs of corneal arcus. If you could show me your tongue, please. Good, so we've got good hydration, there's no glossitis and no signs of anemia. If you could show me the underside of your tongue. Great, and we've got normal blood vessels there, no signs of central cyanosis. So relax down. I'm going to have a look at your neck, particularly the vessels in your neck. So if you could turn your head that way for me. Okay, so I can't see any obvious issues with pulsing here at the neck. So I need to press on your stomach now. Do you have any pain on your abdomen?
No.
Super. If you could just relax your hands by your sides, and again looking back to the left for me. So just focusing here on the neck. I'm going to press in 1, 2, 3. Great, so we've got a small rise at the base of the neck. We know there's no problems there. I'm now going to have a closer look at your chest. As I say, I couldn't see any evidence of scars. I can't see any visible pulsation nor heaves. So I'm going to put my hand on your chest, if that's okay, and see if I can feel where your heart is. So second intercostal space, third, fourth, fifth. So moving round. Okay, so that's the apex, but I'm just going to confirm. If you can turn to the left for me, please. That's fantastic, and come back. So your apex beats in the right location. I'm going to put my hand flat on your chest with some force. Please tell me if there's any problems. Good, and I can't feel a palpable heave. I'm just going to check for signs of a palpable murmur or a thrill. No, that's fantastic. So we've got no issues there. Okay, going to get the stethoscope. And start off, I'm going to have a quick listen to your neck. So if you could take a deep breath in for me and hold it. And hold it. So we've got normal pulse there. No bruise. And breathe normally for me. Take a deep breath in. Hold it. Again, normal pulse there. No bruise. That's fine. Okay, so I'm going to take your pulse as I do so, and I'm going to have a listen to your chest. So listening over the aortic area, the second intercostal space on the right upper sternal edge. Okay, and I've got normal heart sounds 1 and 2. I'm going to listen to the pulmonary area, the second intercostal space on the left upper sternal border. Again, heart sounds 1 and 2 are normal. Listen to the tricuspid area, fourth intercostal space, left lower sternal border, and I've got normal heart sounds again. Moving over to the bell, listening over the fifth intercostal space, mid-clavicular line for the mitral zone. Everything sounds normal there. So we're going to, listening with the bell, roll into the left over the apex beat. And there's no evidence of mitral stenosis. Okay, coming back, we're going to move a little bit further and listening to the left mid-axillary line to see if there's any evidence of mitral regurg. Okay, we're going to see if you can sit forward for me. We're listening for any evidence of aortic regurgitation, so we're going to breathe together. So deep breath in, deep breath out, and hold it. And breathe normally. So whilst we've got you in this position, if you could just cross your arms over your chest, please. And I'm going to percuss over the base of your lungs. So there's no evidence of dullness there, but now we're going to have a listen over the lung bases. Deep breath. And out. In. Deep breath in, please. And out. In. And out. In. And out. That's all normal. Okay, I'm just going to press in on your lower back to see if there's any evidence of fluid there. That's all fine, I can't see anything there. And if you could again lie back for me. And we're going to go and have a look at your feet. So we're seeing if there's any evidence of peripheral edema. So pressing with 3 fingers for 10 seconds. And checking over there's no problems there. And same again on the opposite side. 3 fingers over the inside of the tibia. And there's no problems there. Having a look at the back of the ankles, over the Achilles tendon, I can't see any evidence of tendon xanthoma. So to complete our examination, I'd want to look at any ECGs you've had done, to have a look at the electrical activity of your heart. We'd also review any blood tests that you've had done. Do you have any questions for myself?
No.
Super. Thank you very much for your time.